समदोष सम अग्नि समधातु मलक्रिया प्रसन्न आत्म इंद्रिय मनः स्वस्थ इति अभिधीयते. In the Oxford Dictionary, and it's a Hindi word derived in 2018. And Shakti is nothing but the mother and source of creation, where all the civilization, in whose lab the civilization is being cradled. So every lady has to come across 4 stages in the life. The first one is the menarche, onset of period, that is nothing but puberty, pregnancy, postpartum. Postpartum is nothing but the stage after delivery and the care which has to be given for a newly delivered lady. And menopause is a stage where the cessation of periods. And so this is a slide describing about the unique organs which makes the women to feel very special. They are nothing but the uterus, which we called as Garbhapatra. Patra is nothing but the vessel. Garbhapatra is the vessel which holds the progeny. And ovary and the breast, again, they are 2 important reproductive systems where a lot of hormonal changes happen during her whole life cycle. And to brief with some of the female hormones are, first one is estrogen, second one is progesterone, and third one is prolactin. And fourth one is some amount of testosterone, which plays a very important role during the the menopause. And follicular stimulating hormone, that is one more main hormone to initiate the periods and to note the fertility of the women. And luteinizing hormone. These are the FSH, that nothing but the follicular stimulating hormone, and luteinizing hormones are more secreted by the pituitary gland. And the others are secreted in the ovary. So estrogen and progesterone, they are all produced from the ovary, whereas the other 2 hormones like luteinizing hormone and follicular stimulating hormone are secreted through the brain, that is the pituitary gland of the brain. So as we have discussed earlier, Ayurveda is nothing but the knowledge of life. Ayu is the life and the Veda is the knowledge of the life. So it is a science where we can know about the life. So what Ayurveda explains health as, that is nothing but samadosha, sama agni, samadhatu malakriya, prasanna atma indriya manah swastha iti abhidhiyate. Samadosha is the balanced of all the doshas, that is the 3 doshas which are Vada, Pitta and Kapha. Sama Agni, that is the proper Agni, the digestion fire. Sama Dhatu, the proper balance of the 7 tissues of the body. Malakriya, Malakriya is nothing but the waste of the body, that is 3 malas. So everything should be maintained in an equilibrium stage. Along with that, Prasanna. Prasanna is the happiness. Atma is soul. Indriya is the sense organs, is the mind. So all these things also should be in a very happier way. So those who have got all these things in a balanced way, they are called as swastha. Swastha is nothing but the healthy person. So really, how health is defined as, with regard to a face, as I told you, it is not only the health, external health, even the mental and socio-cultural and spiritual well-being should also be healthy if one has to consider himself as a health person. So as a brief, I told you, in Ayurveda, there is no separate wing called gynecology as in modern medicine, but as a part of Kaya Chikitsa, that is a general medicine, we can see women's health being equally intimated. So that is called Stri Roga. That is gynecology, and we have 2 subdivisions in the Stri Roga. One is Prasuti Tantra and second one is Stri Roga. So these are, they give the ideal guidelines to be followed during pregnancy and the most appropriate time during the conception of the baby, and also the postpartum care for every lady. So first phase of an women's life is the puberty. So puberty is nothing but the initiation of the period. So what are the common ailments what a girl face just during the puberty, or when when she has started menstruating? What are the common complaints what she used to face is PMS, that is pre-menstrual symptoms. That is just before, prior to the periods, there will be lot of changes over the hormones. So that is called premenstrual syndrome. Painful menses, that is the primary amenorrhea. It's like during the initiation of the period, there will be too much of stomach cramps and too much of thigh cramps like that. And irregular or excessive bleeding. So when we take a girl who has just attended a period, there will be a lot of fluctuations. Either she won't get periods for next few months, or there may be a heavy bleeding or a very frequent periods. Leukorrhea. Leukorrhea is a medical term which we denote for white discharge. Next is PCOS, which is a wide spectrum of gynec disease, that is nothing but polycystic ovarian syndrome. So these are all some common ailments what a lady faces during her age of puberty, that is between 12 to 14 years. That is the stage where they face all these medical complaints. And some external problems like acne, hair fall, dandruff, they are all some common problems what a girl faces during her puberty. So when she attends the second stage of the life, that is like when she is getting married, some of the common problems like UTI, urinary tract infection, nutritional deficiency, anemia, and thyroid related issues. It may be an hypothyroid issue or an hyperthyroid issue, and obesity, hair fall, skin issues like dry skin, acne, and some other common complaints like vaginal infection. There may be some itching over that area. Dyspareunia is a difficult, like the pain during the intercourse. Frigidity, that is spasticity of the muscle. Infertility, and when she is newly married, there will be a lot of fluctuations if they use the contraception methods and all. So these are all some common ailments where a woman faces during her initial stages of marriage. So once when she becomes a mother, there are separate set of complaints what like issues what she faces. They are like the pregnancy and infertility and beyond pregnancy, and the lactation problem, and then the post pregnancy complications like secondary amenorrhea. That is nothing but difficulty in getting periods, because once when the lady is lactating, because of the excess of these prolactin hormones and all, her periods won't be very regular. So just after the delivery, they take some months together to have a period. So, and when there is a pain during those periods and all, that is called secondary amenorrhea. And weight gain, again, every most of like 9 among the 10 ladies will have an issue with the weight gain after delivery, and lot of hormonal changes because of the excess of the prolactin hormone and this estrogen, progesterone and all. There will be lot of hormonal changes during her postpartum. And varicosity. Varicosity is like in case of a normal delivery, when there is a heavy pressure created in the uterus, there will be there will be lot of pressure created in the veins of the leg also, which leads to a prominency of the vein in their thighs or even in their calf muscles. So that condition is called varicosity. And lot of back pain also in cases of C-section and local anesthesia or a general anesthesia. They have too much of back pain related issues after an childbirth. And serenity, it has its own complications like mood swing and lot of calcium deficiency disorders, and all the joints starts degenerating, especially the knees where it is indicated as osteoarthritic knees. And PID is nothing but pelvic inflammatory disease. And fibroid, mostly in cases of cesarean section, we commonly see this condition called fibroid. And prolapse of the uterus, that results due to repeated deliveries. And cancer of the cervix, because now cancer is like very common, and cervical cancer has become very common among the ladies. And now we will move on to some of the major health issues of the women and some solutions what Ayurveda can do. I just try to explain some home remedies uh, that can be used in the initial phases before it manifests as a disease. So first we will deal with the polycystic ovarian disease. So this is has become very common in women of a reproductive age, and this is a disease which is characterized by delayed periods and and chronic anovulation period and mood swings and hair fall, excess hair growth in the face and all. Because of the high testosterone levels, this type of disorder like polycystic ovarian disease happens. And the second common complaint is leukorrhea. Leukorrhea, as I told you, is nothing but the white discharge. The lady experience a very unusual thick or yellowish or even whitish foul smell discharge from the vaginal tract or a cervical region, which is very sticky or even sometimes watery also. It can be associated with itching also. And dysmenorrhea. Dysmenorrhea is a term where we use for a painful period, but there won't be any pelvic pathology related to that. There won't be any PCOD or anything like that. But every time she get a monthly period, there will be too much of pain, cramps in the lower abdomen or even the inner part of the thighs and all. So it is again divided into two. That is, primary dysmenorrhea is the one which I explained earlier. Secondary dysmenorrhea includes a pelvic pathology like fibroid or the pelvic inflammatory disease like that. So amenorrhea, it is again one more common problem what every lady face, that is an absence of period. Amenorrhea, that is absence of menorrhea. That can happen even after delivery, or it can be associated with some nutritional deficiency also. So this problem has to be attended very carefully. And infertility, that is a very common issue nowadays many couple face. It is again divided into two, that is primary infertility, where a couple tries, has not conceived even after 12 months of trying. And the secondary infertility is the stage where the couple fails to get when they try for a second issue, but still they keep failing in that is called secondary infertility. Primary infertility, even after several trying, they are not able to conceive. So they are the two types of infertility. And some other common issues like endometriosis, fibroids, gynecological cancer, interstitial cystitis, that is nothing but the inflammation or infection of the bladder, and PCOD, as I told you earlier, and sexually transmitted disease like gonorrhea and all.